So thank you very much. I'm thrilled to be here to present the results of the final evaluation of UpLift. It wasn't my lunch. And I want to acknowledge first off that as the evaluation lead and third-party evaluator, I had the great pleasure of being involved in a participatory evaluation of UpLift that was executed, developed, and implemented by many people in this room. So the evaluation was very positive. So hats off to with some great outcomes, which I'm going to be sharing. And one person, and I think there she is, at the back of the room, Elise. I'm delivering this evaluation, but it was carried out by many, many people. And Elise was the evaluation coordinator. The two of us worked as a team. So I wanted to make sure there was other people involved, but acknowledged Elise's great work. As well, Sarah mentioned a little bit about the structure of UpLift, which the evaluation was guided by an evaluation working group. And many of the members of the working group are actually here today as well. So they can help me answer any questions and they'll let me know if I missed anything. And I am going to miss a number of things because I have 20 minutes and I've now used 3 of it, not that I'm counting. And so I can only focus on a small bit of what UpLift did, but I'll make some comments. I'll give you an overview of what we evaluated, but I can only present the evaluation outcomes of a very small portion. So UpLift, I don't think you've heard this. You've heard a bit about UpLift. Is the vision was or is, I guess it's still underway a little bit, a healthier Nova Scotia through a youth-engaged, health-promoting school approach. And I think what's really important to remember, you've heard a lot about the research in HPS over the last number of years. HPS has been underway by many of the folks in this room for many, many years. So a key of UpLift was uplifting, catalyzing, enhancing the work that was already underway. And I don't know if folks remember this name, Recipe for Health and Learning. Is that familiar to anyone? So that was the original name, and UpLift was chosen by the students and youth in this province. So from the very beginning, Sarah and colleagues, the advisory committee, really used that youth engagement approach. And I would argue, having worked in health promotion for a long time, and HPS has been around for a long time, but that meaningful engagement of youth has probably not been around for a long time. So it had 6 components of work, or 6 buckets or areas of working. In my humble opinion, all of them are needed to successfully engage students and youth to support health promoting schools. So partnerships and leadership, and on the right is sort of a goal or broad outcome that we wanted. We did develop an evaluation framework back in 2019, and that guided our work as well. And so these were identified way back at the beginning. So a health promoting school approach that is resourced by and embedded within the Nova Scotia health and education system. And so that speaks to the importance of system change to sustain this work. Planning and evaluation. So the outcome we hoped for was an evidence-informed health promoting school approach. And that was actually the goal that was developed in 2019. And I would change that now to youth engagement HPS approach across Nova Scotia with a comprehensive accountability framework aligned with partner goals. So once again, that alignment and enhancement. Youth engagement, so engaged and empowered Nova Scotia youth. And it really should actually say children and youth. I don't know if folks are aware, but UpLift primarily worked in older elementary grades. Is that how you say that? Older, from grade 4 to grade 9. There was some engagement at the high school level, but it was mainly in older elementary and junior high. So it should probably say children and youth and students. So engaged and empowered youth who support child and youth health and well-being through a health promoting school approach. Another bucket of activity is school and community engagement in action. So we were hoping for school and community environments across Nova Scotia that support child, and got it there, and youth health and well-being. Capacity building was another element, so a lot of work done in this, linking with organizations such as the Education Leader Consortium of Nova Scotia, also NSH and education to build capacity and learning opportunities. And we hoped for an evidence-informed practice within the Nova Scotia health and education systems and the broader community. And finally, communication and knowledge exchange. So it was hoping for building awareness and understanding, but community support. So support at the community level, the regional level, and the provincial level for a youth-engaged HPS approach. Those were the 6 buckets, just to give those who aren't familiar the comprehensiveness of UpLift. And I'm not going to go into these slides. We did have other outcomes. Unfortunately, I don't have time because I've gone over my time probably where I should be on my slide now. But we had other short and long-term or intermediate-term outcomes in each of those areas. So the evaluation was done over 5.5 years. I mean, I know UpLift is continuing to go on and will end in March of 2025 in its last leg. But it was a mixed method approach. We had many different methods, quantitative and qualitative. We gathered data from multiple sources and at various points in time. So we produced annual evaluation reports. We produced reports in each of the regions where UpLift worked. We produced reports on capacity building and learning opportunities, on partnerships and the development of that. And then it culminated in the final evaluation report. And so we had tracking forms, which if anyone was filling those out, they might want to kill me, but they gave us a wealth of data. The youth engagement coordinators, you heard about them. They were key in this initiative, and the UpLift core team filled those out. We had key informant interviews with the youth engagement coordinators, the partners, the core team. We did processes like story sharing, which is a participatory approach to gather data and together with the participants, analyze and theme that data. We had multiple surveys of the capacity building opportunities and partnerships, and we did focus group with students and staff champions, and Elise led a process that was also informed by the provincial youth engagement coordinator, very participatory to engage students in a interactive graphic way, so of multiple ages. So it was a very comprehensive, and I get tired looking at this slide, but it was all good. And in the end, UpLift was in, I'm getting a blank, I'm drawing a blank. How many regions? I mix up the youth in 6, thank you. In English school boards, so we call them regional centers for education, as you well know, and CSAP. So it was, we just missed in 2 of the RCEs. Sarah and Julia have alluded to a key part of the process was not only the youth engagement coordinators and the work they did, but also that $5,000 student action grant. So in total, 163 grants of $5,000 each were administered for an investment of $815,000. And those grants, I'll talk about that a little bit more. They covered a range of issues. So from mental health, a lot on mental health and physical activity, healthy eating. So there was a number of different topic areas, and they also looked at the social and physical environments, addressed that. So I'll talk more about that. So in total, there was 176 schools that participated in the grade ranges there that you see, and with 54,000 students engaged. So I am going to give you some of the data or the evaluation findings. This really should be the evaluation and research showcase event. Anyway, but that's okay. I'm an evaluator, so that's where my background is. But I'm going to be talking about some outcome data around the partnership and leadership element. And this was the partnership and leadership building at the provincial and regional level, as well as at the community. This particular area is more at that I'll focus on at provincial and regional, was critical in order to move this work forward with one of the most impressive outcomes that happened, the investment that was made in youth engagement coordinators in this province. So this work, as Sarah mentioned, talks about how partners contributed primarily through the advisory committee, which had mainly provincial but also regional representation, but it also represents contributions at the regional level. And the contributions, we got a lot of this data from the tracking forms that were completed by the core team who fastidiously tracked their work to build leadership and build partnerships. And we also obtained it through partner interviews of the the advisory committee and working groups. So we ended up conceptualizing or documenting partner contributions in 3 areas. And you'll see the 3 there. And it's not to mean that they're more or less. It's meant to represent that partners can contribute in different ways to this work. But we need all of those contributions in order to move the work forward. So networking and relationship building was how some organizations, you'll recall that Sarah said we had several organizations from education, from health, from community culture, tourism, and heritage and communities. And so there was different varying levels of contribution. But some of it was simply participation, which was important on the advisory committee or working groups, and sharing information and outcomes within organizations. So perhaps organizations that hadn't been doing as much work in health promoting schools. So that was one level of participation. And next was connecting and aligning. So that is extremely important because how this uplift was conceptualized was not new. It was building on work that Nova Scotia has been doing. I was just having lunch with someone that I think goes back 40 years. So the work in schools and the good work around trying to support students to be well and healthy. So we wanted to make sure we connected. So, for example, the youth engagement coordinator positions were not hired through Dalhousie University, or they were resourced through the UpLift grant, but they were hired at the local level by NSH. So that is something that's actually critically important, I think. And they were connected it with existing structures and processes. So there's been school health promoters around in Nova Scotia for, I don't know how long, early 2000s, 20 years. So a long time with a lot of great work. And we knew the youth engagement coordinators, that position would do some similar things, but we wanted to figure out what would be the difference. So that connecting and aligning, those positions were positioned within the system. And I think the evaluation shows that was a very smart decision. And the other thing that partners did and contributed is they identified opportunities within their organization to link the work. You've heard about some of that, linking to student success planning, linking to other work like Schools Plus, linking to curriculum. So it was important that at the provincial, regional, and local level, that those opportunities were identified for Uplift. So UpLift came to meetings such as like a principals meeting where it could be awareness could be built at the regional level. Those types of things were what partners did to help make sure that UpLift was able to catalyze this work. They contributed expertise. They helped to mitigate risks and problems. One of the big ones, as Sarah alluded to, not a problem, but sort of a problem, COVID-19 and the pandemic. So how do you pivot or bend? I think it was a bend strategy during such a major event. And partners also helped in strategizing to learn how to work within systems and within their own organizational systems to move and embed this work. Partners also actively collaborated and invested. So they actually planned and co-chaired the advisory committee and other working groups. They planned and developed capacity building opportunities, which I'm not going to be talking about the capacity building, but that was significant. And on this card, the card there, there's going to be that website that Sarah referred to. There's some great resources that were created by you and UpLift with UpLift resources that I think will push the work of youth engagement in HPS in the longer term. And there was folks invested in resources. We'll talk about that a little more. So these are a couple of quotes that Claire, my boss, told me to take out, and I didn't because she said it takes too long to read them, Stephanie. But with the information sharing and connecting of ongoing initiatives, colleagues and projects, this is a partner talking about what they were doing, trying to align the stars to empower and enable the work of UpLift, other people's work for other projects, and how it can lend well or complement each other. I would say that connection piece is how we're supporting it. And then this speaks to another partner quote, the EYC positions under UpLift are integrated into our HPS work. And staff are supported by managers. From a program perspective, we've nested it under the umbrella of HPS. So I think that's so important because you don't want to, I got it. We don't, don't worry, I don't have 5 minutes left or 10. We don't want to lose sight of all the work that has been done and building on that. And I think that was one of the strengths of UpLift. And one of the outcomes we were hoping for is that this new, not new, but growing approach of youth engagement and HPS would be embedded in provincial and regional systems and at the local level. And so we conceptualized this of how it was embedded along a continuum from successfully building awareness and understanding about HPS and youth engagement in HPS to actually changing the culture. And so UpLift illustrated this. We got this data once again mainly from the tracking, not mainly from the tracking forums, partly from the partner interviews and some from the tracking forums. So I'll focus on the embedded and changed practice. Examples are that HPS and youth engagement was embedded in the training of other organizational staff. So there's some great learning opportunities and resources that have been developed. And one of a great example of this, as I mentioned, was at the Education Leadership Consortium and some of their training of administrators, as well as youth health center coordinators within NSH. So that youth engagement training and HPS training was embedded within their orientation, actually. You've heard a bit about this, how HPS and youth engagement is now incorporated within planning and curriculum in the education system, and that UpLift evaluation tools are incorporated within current planning and evaluation processes. And that was through the participation of NSH, public health at NSH within the evaluation working group, linking to standards and the indicators, and so building on the work that we were doing in UpLift and that was also being done. And as I said, public health at NSH invested in 9 youth engagement coordinator positions across the province. Partners invested significant time, and we tracked that. And we were starting to see an organization changing their practice. And I have some great quotes, but I can't share many of them, although I can share these two. So the process of youth engagement work has totally rubbed off on teachers in terms of teachers adapting those principles that have been used in youth engagement work by the coordinators and the school health promoters. That message is getting out there to teachers who wouldn't necessarily have had any kind of training in their earlier education. I really think that the foundational youth engagement work has been a real shot in the arm for a lot of people's teaching practice. This is not to diss any teachers. There's excellent work going on. But sometimes when you say, oh, we want to build capacity around youth engagement, people will say, well, we do youth engagement. Are you crazy? We work in schools. That's what we do. We engage students. But I think UpLift demonstrated, and Julia's and the ability to have researchers come in and dive into this, that approach is critical to understanding it. And Julia has illustrated some of that in her presentation. I'm not going to read the other one. So the other part I'll share is the outcomes around youth engagement and school community engagement and action. Once again, a tremendous amount of this work was facilitated by youth engagement coordinators and the use of those $5,000 HPS student action grants. So this is where I said, Kate, that diagram was wrong because this was developed through a participatory approach. I mentioned that we did regional evaluation reports throughout the 5 years of UpLift, and we presented those back to existing health promoting schools committees at the regional level, and we talked about it. And through that work and the work of the evaluation working group, we actually defined and conceptualized the role of the youth engagement coordinators and their approach. And I think that was really important to do because when UpLift started, there was a job description for youth engagement coordinators, but it was a bit of a bumpy start. And they're like, well, what is their role? And it was meant to be a community development for the role to be defined over time. And I think we successfully did that. So you can see some of the key elements of that role is they're a champion for youth engagement. They're a role model. They advocate. They engage in planning and evaluation and celebration. You heard some of that already. That's part of their role. Critical is building of partnerships and relationships at the local level and regional level and sometimes provincial level. Capacity building, so actually offering learning opportunities or linking people at the school. So the youth engagement coordinators really not only engage students, they engage the entire school community. And so I think that's really important to understand. The administrators in schools, the teachers, other staff, and community partners. So that was really important. Another key element of the role is communication and knowledge exchange. And I should say some of the communication and knowledge exchange work of UpLift, which I can't discuss because I don't have time, but that work is very well documented in videos. And I think that's critical in terms of some of this work that we're doing. In engaging youth is showing it to our colleagues and to senior leaders. And so some of those videos are from the words of students and youth. And so I think I just want to mention that. So we showed that we strengthened student voice through UpLift to inform HPS. Most projects that were done, those grants were student-led. So they allowed students together with school staff to identify, understand the local context of their school, identify needs, and that's how they decided what they do. They were able to advocate. Students, through the focus groups that Elise led, talked about how they felt heard and respected, and that approach that was done, that Julia talked about, the meaningful youth engagement that I didn't mention on the last slide, but that was another element of it. So one comment from a student, it's definitely taught me a lot about leadership and stuff in the community. We plan stuff, and then it actually happens. So it teaches us that we have a voice. And from a staff champion focus group, we didn't tend to consult with students and involve them in decisions to reach out to understand their priorities and interests. I find that now the links between staff and students are much stronger and that students are heard and valued. So also we demonstrated increased meaningful leadership role for youth in HPS. As I mentioned, they led those student action grants. The youth engagement coordinators, I get tired thinking about their role, but they worked with existing student leadership committees like Gay Straight Alliance or others. They formed action teams or supported the formation of action teams. And I don't think I don't want to underestimate the important role of the staff champions and staff in school because that's critical as well. And that's what the youth engagement coordinators, they supported that role. Student leaders were empowered to select, develop, and implement those projects. You can see some of what they did, the needs assessment, the planning, collaborating. So students did that. And a couple of examples of the enhanced social and physical environment. I think it was 163 grants that developed into some wonderful projects. Here we see an example of a mental health resource room and a community bike track. So, there was a lot of enhancements made to the physical environment, indoor and outdoor spaces, and because it happened during COVID-19, quite a bit of interesting infrastructure development outside for learning. Tents with wood stoves in them. You remember all of that outside learning spaces, which was awesome. Social environments changed, quiet corners, the development of all gender washrooms, and that involved collaborating with others to get more resources than the 5,000 to support that. Many of the projects related to the student success planning, they were linked to that and student well-being. And grants were described as the catalyst for change and helping to begin to shift that culture. And I think I'll just read a couple of quotes here. Our Student Success Plan Wellness Lens has really been driven with this work, the UpLift HPS work, with the outcomes of the work. So that's something that will foster change throughout the school and potentially shape how we look at things going forward. And then the other quote talking about teachers being able to add that well-being or health lens actually within their classroom as well as the broader curriculum. And I think I'm out of time. Am I, Claire? So I won't go over this last slide. There you go.